Hi, I'm Dr. Matson. Today we're going to be talking about population health for nurses. Specifically, we're going to be looking at the social determinants affecting health outcomes. So this is following the OpenStax textbook, and what we're going to cover today is economic stability, neighborhood and built environment, and educational environment, access and quality. We're going to look at the social and community context and the cumulative effect of inequalities on health. So in the United States, clinical care accounts for just 20% of a person's health outcomes. When we look at social, economic, health behavior, and physical environment, those are responsible for 80% of the health outcomes. So a person's zip code has more bearing on health than their genetic code. So what you're looking here in this figure is this wheel of social determinants of health. So you can think of these as the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems that are shaping the conditions of daily life. Also, when you look at Healthy People 2030, these social determinants of health, this is the graphic domain label that the U.S. Department of Health and Human Services uses to show this. So these learning outcomes are what you should be able to do by the end of this lecture. So these are your own learning goals. So basically, you want to be able to discuss the relationship between poverty and economic insecurity and look at the impact on employment, on social instability, and be able to explain how housing instability really contributes to economic insecurity, and then link that social determinant of health and a person's socioeconomic position with their health outcomes. So economic stability, when considering social determinants of health, is the ability to access necessary resources and care to promote healthy living. So for an individual or family, economic stability is the state where the individual has a steady source of income and regular access to resources that are really essential for healthy life. So one part of this would be the living wage, and we'll discuss this more as we continue. So when we think of economic insecurity, this is where you cannot consistently afford housing, food, clothing, transportation, childcare, or healthcare, and that is directly linked to poverty. So in 2021 in the United States, close to 12% of the population was considered economically insecure. The socioeconomic gradient is another term for the relationship between income and health, and this is the association between low socioeconomic position and increased disease risk and premature death. Generational poverty, this is a phenomenon where there's persistent poverty and disadvantage. So the main driver of individual economic stability is employment and wage. So job demands, the work environment, compensation, how secure the work is, and all of these affect an individual's health status. And when we talk about individual status, we could think of people as being in the workforce, retired, so retired, employed, unemployed, looking for work, or underemployed. Disparities in employment are correlated with race and ethnic background, gender, and level of educational attainment. So correlated with economic insecurity would be things like difficulty paying rent, living in overcrowded residences, moving frequently, or spending large parts of the income on housing. So we consider that spending large parts of income on housing. Households are deemed cost burden if they spend more than 30% of their income on housing. And in 2019, over 37 million cost burden households in the United States were noted. And when we look at severely cost burden, so spending more than 50% on the housing, there was almost 18 million. So substandard housing is associated with health risks like asthma, allergies, mental health conditions, respiratory illnesses, and severe housing instability can lead to homelessness. So here you're looking at an individual experiencing homelessness or being unhoused, and they have a risk for health issues. You can look at this picture and start to think of a few. Inadequate nutrition, exposure to violence, communicable disease, and exposure to weather, and how that would impact their all of their health outcomes. So if you're thinking about kidney disease, heart disease, chronic and both non-communicable diseases. So as a nurse, one of your main components of looking at someone is assessment, right? So here we're thinking of assessing for poverty in all patients and clients. It's the very first step in the nursing process. The first one is just to do this, you have to have an awareness about the prevalence of poverty and then the associated negative outcomes. So intervention is the next step. So nurses can then put in referrals to case management and social worker to help with support programs and subsidies to low-income families. And the other things are looking at living wage and societal benefits for improving communities that are impoverished. Another aspect of the assessment piece would be screening for both physical and psychological work-related hazards in this lower income group or people who are working in higher risk jobs. So assessment is really key. We're going to switch here. So by the end of this next section, you should be able to talk about food insecurity in deserts and look at the relationship between crime and violence and health outcomes, be able to define the built environment and examine how the built environment influences health, and be able to assess the effect of housing and environment on health outcomes and explain how environmental conditions impact health. Food insecurity, this is a condition where people have limited access to adequate amounts of high quality food. This is influenced by income, employment status, race, ethnicity, disability, and it increases during periods of unemployment. So in 2020, BIPOC households were more than twice as likely as the national average to struggle with food insecurity. People with disabilities have a higher rate of food insecurity. And when we're talking about food deserts, these are areas where there is limited or no options for affordable, healthy foods. Food affordability is a major obstacle. So people living in food deserts are at higher risk for obesity and diabetes. So when we think about the role of the nurse in addressing these food access disparities, so community health nurses have a major role in advocating for people experiencing food insecurities. And then school nurses are really at the forefront. They're promoting healthier food options in school. And then those who work in the county often partner with local food pantries to help provide access to healthy food to people who need that and they can connect them to benefits through existing programs, and really influence policies to limit the number of fast food restaurants in a community. So crime and violence. This adversely affects people who are experiencing the crime or violence, the people who witness it, the communities who are surrounding it, and the perpetrators. So this could be child abuse, firearm violence, intimate partner violence, sexual violence, or elder abuse. Violence has a cumulative biological effect on the brain. We know that the neuroendocrine system and immune responses are triggered, and this repeated exposure to crime and violence is linked to increases in negative health outcomes. When we look at this in childhood, these exposures to violence are considered adverse childhood experiences. And individuals who have these experiences and who may be economically insecure, they could live in areas that lack resources, have higher rates to this crime and violence, and then have negative health outcomes. When we think, what is the nurse's role in addressing violence? There could be educational programs that nurses build when they're working in schools and in the county to help develop interpersonal relationships and resilience. They could put in referrals and raise awareness for emotional regulation, like we said, problem solving, teamwork, and then building a culture of accountability. When we talk about the built environment, this includes transportation access, so roadways, green space, the physical buildings and structures. So all of this is the built, we're talking about the built environment. Almost 20% of economically insecure households lack access to private transportation. So more economically insecure people, they drop out of the labor force because they don't have a means to get to work, or a reliable means to get to work. And the availability of green space, so if that is lacking, like sidewalks and bike lanes, then people are going to be less active, and that can also have a major negative health impact. So nurses can advocate for shared green spaces. They can help build community partnerships. So if they're working like at a university here, we can put in research programs, work with the county, work with community partners. Nurses who work in schools and who are in public policy also can advocate for playground structures, more things like tennis courts or pickleball courts or basketball courts. And this allows them to advocate for more physical exercise, education. And then when we think about this in the school nurses can be the ones advocating and showing the research, the evidence-based practice for why there needs to be more outdoor recess time and physical education in schools. So when we think about housing, right, we can also think not just about if someone is housed or unhoused, but what is the actual physical condition and quality of the environment. So we're going to go a little bit deeper, because poor housing quality contributes to negative health outcomes like presence of lead, mold, asbestos, radon. And we think of overcrowding, we're now thinking that that can be a higher risk for transmitting communicable diseases. And we can look at air quality, because we know that poor air quality has negative health outcomes. And also water issues like lead leaking or mold leaking into the water, exposure to asbestos. All of this is going to cause poor health outcomes. So nurses can be key advocates for better quality housing. They can assess for these mental and physical repercussions, so to speak, from living in these poor quality homes, and be able to assess the lived experience of community members, whether that's through a qualitative study, quantitative study programs through the county and schools. And they can screen for issues like lead poisoning, mold-related injuries, mental health issues, and communicable diseases. They can work to develop appropriate policies to protect people. And then in this way, from nurses working in hospitals to counties to schools, in research at universities, are all well positioned to affect change. When we talk about these environmental conditions and we say, okay, these have poor health outcomes, well, what are we talking about? Poor air quality can cause respiratory illness, lung cancer, and even heart disease. Here you're looking at a picture of a neighborhood and built environment, right? We're thinking about poor air quality here. And just by looking at this picture, I want you to think, what does this mean in terms of someone's health? Are the short-term, long-term respiratory implications think about it in terms of children, elderly. Start imagining how this impacts the community directly affected by this picture, but also what about fires in San Diego and Los Angeles, and air pollution. We're talking about water quality. This means safe, regulated water for drinking, bathing, and cleaning. It's a very important health determinant. Annually, an estimated 7.2 million people contract a waterborne disease, and there is the Safe Drinking Water Act, SDWA, which allows the Environmental Protection Agency to set and enforce standards for drinking water quality. So water quality can be affected by both natural and built environments and also socio-political factors. For example, the Flint water crisis. Extreme weather has an impact on health. We can think about this in terms of heat waves to tornadoes and floods. So there could be direct injury and death or infrastructure damage leading to negative health outcomes. And this can cause a very fundamental threat to human health and well-being, mentally and physically. So nurses, they are at this core of being able to advocate for policy change, monitor and assess population health, so investigating health hazards, looking at root causes, conducting studies, educating and mobilizing the public. They're positioned as leaders between community partnerships and again can advocate for policy change. So now by the end of this next section, you should be able to distinguish between health indicators and education level, explain really these implications of poverty, disability, and discrimination on learning and access to quality education, and always be connecting this back to health outcomes, and then also looking at social determinants of health and health literacy. So early childhood development and education, early life stressors and ACEs impact a child's health. So this contributes to developmental delays, poor outcomes later in life, and poverty impacts children's academic achievement. Quality education helps foster both mental and physical development of children, and also is an important determinant of health and well-being for their lifetime. Receiving quality education reduces educational disparities in children, and there are moments even throughout their educational career that have a very high impact and project how they're going to do throughout their career. So if we look at third grade and then the literacy level and reading level, that is predictive of how people will do in high school in some research. So disparities in high school completion rates exist by race and ethnicity. Lowest groups are for Black and American Indian, Alaska Native students. If there's a lack of parental involvement, this is linked to lower rates of completion. And school is not all equal. So it's the quality of the education and also the student's perception of this quality. This has a very high impact also on their completion rate. The reading skill, like I said, in third grade is linked to high school completion rates, and positive outcomes are linked to high school graduation. There's a decreased risk of premature death, more employment opportunities, and then that impacts that economic stability, which then impacts all those health outcomes we talked about, and higher lifetime earning potential. So enrollment in higher education in general, college graduates' lifetime earnings can be double those of individuals without a degree. And of course, the higher the earning, the greater ability to secure material and social resources, and how well an individual's middle and high school prepares them also influences their likelihood of success in completion and graduation in college. BIPOC individuals still demonstrate lower levels of academic persistence compared to white students. So when we think about this in terms of what is the role of the nurse here, so community and public health nurses really are key in this childhood and primary and secondary education. They're in the school systems. They have the ability to influence change on those levels and at the county level and in research. So we use assessment data as foundational for influencing policy and development at local levels. advocate for support and increased funding. So we grant programs, like I said, and research making high impacts here. When we think of language and literacy, health literacy refers to an individual's ability to find, understand, and use health information. Limited English proficiency can be a barrier to accessing healthcare services. So individuals who say they have less English proficiency are less likely to have a primary healthcare physician, therefore less likely to have preventative health care, less likely to be screened, have poor prognosis. They may also have difficulty following medication instruction and communicating with healthcare providers when they have questions or are uncomfortable with the care. If there's a lack of interpreters and culturally sensitive providers, this also adversely affects health outcomes and the ability to adhere to the regimen or receive it. So this next part, we're going to talk about civic participation, discrimination, and social determinants of health, incarceration, and the importance of social capital, all of this, how this impacts health outcomes. So civic participation, this is a range of activities that benefit the community. Social capital, this is the value gained from having a positive interaction and connection between people working together. And overall, volunteers experience psychological well-being and emotional health. So being able to participate in these things actually improves health and well-being. So here, looking at the social and community context, volunteering to have a community garden, right, to improve access to nutrition food. And we see here a range of ages participating. So when we now switch and talk about discrimination, this is unfair treatment of people and groups based on social perception of characteristics like race, ethnicity, gender, age, religion, sexual orientation, and ability. So discrimination is a public health threat. It results in adverse health outcomes across the age spectrum. It occurs at individual and structural levels, and structural discrimination refers to institutional policies, systems, and laws and practices that limit opportunities and resources and power for certain groups. So discrimination based on race is linked to significant health disparities and poor health outcomes. Incarceration affects people of the health of the people who are incarcerated. They have poor health outcomes, but also their families and their communities. And BIPOC communities and individuals with lower levels of education are disproportionately affected by higher incarceration rates. So individuals with a history of incarceration also have worse physical and mental health compared to the general population. When we think about the families and the people who are incarcerated, community and public health nurses really have a role in identifying these children who are at risk and assessing for them, and then providing intervention and resources to help. Social cohesion, when we talk about this, this is defined as the strength of a relationship within a community. So this collective efficacy is another aspect of social cohesion. It's based on trust in a community's ability to create change and influence behavior through social norms. So higher levels of social support positively influence health outcomes, such as healthier eating habits, exercise, and dealing with stress. And when you look at social networks, these are really foundational to a healthy and thriving community. So here now we're going to look at health inequity, health disparities, and social determinants of health, and this cumulative impact of inequality on individual and population health. So health inequity is differences in health status and resources between population groups, and this can arise from social conditions. Equality, when we talk about that, this is situations where individuals are given the same resources and opportunities. And equity is everyone is not the same, but resources are distributed as needed by an individual to each individual to reach an equal outcome. So when we think about this, we want to think about how we've talked about quality of housing and food insecurity. and what that means in terms of education and health outcomes. And think about these pictures, someone living in, you could say both people have a home, right? They have equal amount of resources. They both have a home, they both go to school. But how is it different in these two different environments? And what can we do to help improve health outcomes and opportunities? That concludes our lecture.